This is Vamshi. Welcome to my YouTube channel. So we will discuss some of the important questions for the aiims norcet exam. So the exam is on the Saturday, June 3rd. So the first question is the first appearance teeth in child. So what is the name of the teeth which appear first? Options are premolar, premolar, incisor, okay, incisor, canines, and third molar. So which one is the right answer? The right one is option B, incisor. So incisor teeth are first apparent teeth in the child. So the next one is types of paralysis. Okay, so what is the main cause of paralysis? Brain injury. Okay, when the person have got the head injury, it leads to the brain injury. So the person may risk for the paralysis. So in the paralysis, we have the four types mainly. So the first question is first type is the hemiplegia. So hemiplegia in that the person have the okay, so the person have one side of the body is paralyzed. Okay, so either it is right or left. Okay, so if the person have the damage of the brain, either hemisphere is nothing but the two parts of the brain. Okay, so if the person have injured this side, the person may have paralysis this side. So the hemiplegia is nothing but right side or left side, either one side of the body is paralyzed, it is known as the hemiplegia. So the next one is the paraplegia. So what is the meaning of paraplegia? So in the paraplegia, the person will have the lower limbs. Okay, so lower limbs are affected for the paralysis. So lower limbs are nothing but legs. So the person have affected by the paraplegia, that is nothing but lower limbs are affected, that is paraplegia. So the next one is a quadriplegia. So in the quadriplegia, the person will affect the whole body. Okay, so person will have whole paralysis, that is nothing but quadriplegia. And final one is the monoplegia. So in the monoplegia, the person will have the any one limb of the body, either it is legs, any leg or hand. Okay, any single leg or hand, one side. Okay, only one side of the body and a single limb. So that is monoplegia. Mono is nothing but one. So the monoplegia is affected by the only single limb of the body. So we have the four types. Hemiplegia is nothing but one side of the body, and paraplegia is nothing but lower limbs of the body. Quadriplegia is whole body. Monoplegia is one limb, any single one limb. This is types of paralysis. The next question is poor man meat is known as. So the poor people eating food, among that, which one is called poor man meat? Options are wheat, cereal, pulses, and maize. So the right one is option C, pulses. So pulses are consist of high proteins. So this protein is important for the person for to get the muscle. So when the poor man doesn't eat, doesn't have to buy the meat. Okay, chicken, mutton, fish, or something else. So when they eat pulses, it is known as the poor man meat. The next one is Fabry disease. Fabry disease affects. Okay, Fabry. So Fabry disease affects the among the mitochondria, cell membrane, lysosomes, both A and B. So which one is the right answer? So the right one is option C. So option C is the lysosome. So Fabry disease is nothing but Fabry disease is a inherited neurological condition. Okay, so it is coming by the from by birth. From birth itself, the person may risk for the Fabry disease. So mainly, what is the meaning of Fabry disease? It is nothing but it is a enzyme alpha galactolase galactosidase. So this is cannot be efficiently break down the fatty materials. Fatty materials are nothing but lipids. So when doesn't have the person alpha galactosidase, so the patient doesn't make the fatty materials into lipids, nothing but smaller smaller components. So what will happen? The person cannot give the energy for the body. Okay. So due to the damage of lysosome. Okay. Due to the uh, dysfunction of the lysosome, what will happen? Doesn't have the alpha galactosidase enzyme, so it leads to the lipids cannot break down into smaller components to give the energy. So what will happen? The fat tissue which will be stagnated in the body. So this is called Fabry disease. The next one is, which hepatitis is known as serum hepatitis? Options are hepatitis A, hepatitis B, hepatitis C, and hepatitis E. So the right option is option B, hepatitis B. Hepatitis B is also known as the serum hepatitis. So the next question is, which position is used to facilitate maximum air exchange? So when the person having the dyspnea, so as a nurse, which position you will prefer to have the a maximum air exchange? So the right option is a orthopenic position. So in this position, the patient will sit on the bed and leaning forward. So he will put the hands on this, and this is a bed. Okay, so he will sit on a cardiac table. So this is a cardiac table, and he will lean forward. So this is called orthopenic position. The next question is, Jigger chart is used to detect. So what is the purpose of Jigger chart? Options are color blindness, near vision acuity, peripheral vision, and distant vision acuity. So which one is the right answer? What is the purpose of Jigger chart? So the right one is option B, near vision acuity. So when the person is having the near vision problems, by using the Jigger chart, we can detect the person having the near vision problems. So in this chart, we can assess the near vision by giving a paper, otherwise a board, which consists of paragraphs. Okay, small paragraphs. It's just like a letter or the book. So this kind of chart we can give to the patient to read. Okay. So this Jagger chart, it's looks like a Snellen chart, but in the Snellen chart we have the big letters, but in the Jagger chart we have like a book and consist of paragraphs. So if the person doesn't read the paragraphs, we can identify the person is having the near vision acuity. The next question is Norton scale. So what is the purpose of Norton scale is used for? So the options are peptic ulcer, pressure ulcer, gangrene, body mass index. So what is the right answer? Option B, pressure ulcer. So Norton scale is used for assessing the stage of, so which stage of pressure ulcer by using the Norton scale. So this is the right answer, pressure ulcer. So the Norton scale consists of 5 components. So the first one is a physical condition, and the next one is a mental condition. So all these are come under the Norton scale. So third one is the activity, and fourth one is mobility. Mobility is movement, and finally incontinence. So these are the 5 components we can see in the Norton scale. So it has the scoring like a, so it has the scoring. So if the person have the 18 score, means the patient may have greater than 18. It is, if it is greater than 18, the patient have the low risk. So I will write here. So when the person getting the 18, it is low risk, and if the patient getting 18 to 14, it is medium risk, and 14 to 10, high risk, and finally 10, this is very high risk. So these are the components are in the Norton scale. So Norton scale is used to assess the pressure ulcer. The next question is identify the calcium channel blocker CCB from the following. Options are nifedipine, okay, nifedipine, atenolol, Lasix, and mannitol. So which one is the right answer? The right one is nifedipine, option A. So the calcium channel blocker drugs are end with pin. Okay, nifedipine. So this drug is known as the calcium channel blocker, which will control the blood pressure by blocking the calcium agent entry into the cells. So these are called calcium channel blockers, that is nifedipine. So next question is Gomes classification is used to grade the condition of children. So in which condition we can use the Gomes classification? Options are respiratory distress, PEM protein energy malnutrition. Okay, and the next one is a premature cardiac disorders. So which one is the right answer, and what is the purpose of using Gomez classification? So the right one is option B, protein energy malnutrition. So Gomez classification is used to identify the condition of protein energy malnutrition. So protein energy malnutrition mainly divided into kwashiorkor and marasmus. So the last question is, the yellow color of urine is due to the presence of. So in the urine we can observe that urine have the some yellow color. So what is the reason to have the yellow color of the urine? Options are urochrome, stercobilin, melanin and keratin. So what is the right answer? Option A, urochrome. So due to the presence of urochrome, so the urine has the yellow color. So which is coming from the liver, urobilinogen. Okay, so due to the presence of urochrome, the urine is yellow color.